I'm going to start with the questions to the speaker. And wow, one's a book here. Let's start with a simple one. So if you're ready, Dr. Sadigh, here's the first question.
Yep.
Which part of sleep gets affected by these psychological conditions? Which part of sleep get affected by these psychological conditions that you presented tonight?
Oh, that's an excellent question. So if you remember there, we have three clusters. Cluster C is the anxious cluster. So anxiety plays a significant role in sleep onset. Anxiety tends to keep you in the earlier stages of sleep, in 1 and 2, so not as deep sleep. And that's why you see a manifestation of a lot of achiness, and because they don't go into slow wave sleep effectively. They remain in shallow sleep. So, and it's in slow wave sleep, N3 is when you will see a increase in somatotropin levels. So anxiety keeps you in shallow sleep, and then you go into REM. So with dependent personality, because it has a very powerful depressive feature, you will see an extended REM cycle. So in depression, we do see more than usual REM. So the earlier stages are squeezed somewhat. So they go into REM and there's awakening. And please remember this, that the the earlier REM events, so let's say we get 6 of them, the earlier REM events are disturbing. If I were to wake you after 90 minutes of sleep, after REM, if I were to wake you, you will be in a negative mode. You will be disturbed because the imagery is very disturbing in early REM. Those images and future images are more consolidated and make more sense when you approach like 6, 7 o'clock in the morning. Therefore, in depression, you will see more of a negative mood because they wake up during those. They usually don't remember their dreams, but they're in a bad mood. They're up and very upset, anxious, panicky, worried about what's to come, which is very common feature in dependent personality disorder. You will see the nocturnal panic attacks frequently in people who suffer from obsessive compulsive personality disorder. And this is because they want life and all the activities in such a prescribed, rigid, highly defined and structured way. And losing those structures give them a sense of panic. It's probably the most disturbing form of panic disorder for someone to experience. And that is when you have a panic attack in slow wave sleep. Very, very disturbing. So anxiety absolutely has a profound impact on sleep. Unbelievable impact. Sleep onset, sleep maintenance, and because of the lack of those slow wave sleep, you will see persons unrefreshed. They wake up tired, achy. They don't get quality sleep. That was a magnificent question. Thank you. So this is the cluster for making sleep difficult, falling asleep, and maintaining sleep.
Excellent. Thank you, Micah. The next question is a very long one. I'll try to read it slowly because it may take up a lot of time, but it's an excellent question.
Please.
It starts off with, thank you so much, Dr. Sadigh. This webinar is going to help me understand my patients so much better now.
Honored.
My question is, I have a 32-year-old patient who is a physician. She was given a night guard about 15 years ago because she was concerned about grunting and teeth wear. She has worn that night guard every single night, perhaps 1 or 2 nights a year. Maybe her birthday and Valentine's, who knows? Anyway, 363 days a year, she's worn a night guard for 15 years. She claims to be a very happy person, but recently lost her tooth due to a catastrophic fracture and has developed an extreme anxiety about losing all of her teeth eventually. This is a 32-year-old physician. Extreme anxiety about losing all of her teeth eventually. She has Googled dental issues, as all good doctors would do, of course. She's Googled dental issues to an extreme level, and I have spent several hours trying to reassure her. Here's the question. How do I approach her upcoming restorative appointments? Question mark. Should I discuss her anxiety regarding her dental issues? Thank you very much.
Oh, my pleasure. What an incredible question, and thank you. That was detailed and incredibly helpful. So let's go back and look at what's the dynamics of what's happening to this individual, to this physician, who has been so incredibly good at. She has not missed. She's missed twice a year. And missing means somebody who has an incredible sense of structure and likes things in following a certain set of rules. So just jumping ahead and tell you what the dynamics. Teeth give you a sense of power and control. Symbolically, that's what teeth do. So they give you a sense of power, and you can chew with them. They affect your speech. So losing them symbolically means I'm losing control. I'm losing my power. Her anxiety may very well be the manifestation of loss of control elsewhere. Unconsciously, it's almost like having a dream in which you wake up and your teeth are gone or they're falling out, etc. But losing power, where else are you losing control? So you can repair that tooth or replace that tooth, an implant or something, or protect the other teeth. It really has very little to do with teeth. It has to do with loss of control. What are the things that are going on in her life that are making her feel as though she has no control over her environment? That topic needs to be explored. And this is why I highly recommend that you have a consulting psychologist who could address some of these issues when they come up. You're extremely important. Again, remember, you're going into their unconscious when they open their mouth. So what you say to them, how you say to them, the things that you say to them, go deep into the unconscious. This has less to do with her teeth than has to do with I'm following things. Everything has a rule. Everything has a structure. Something is upsetting that structure. You will see this in, if I get to the next one, is in the obsessive compulsive personality disorder. I am not suggesting that's her diagnosis. Obsessive compulsive personality. Anytime anything deviates, moves outside the norm, and teeth, follow a certain pattern, they have a certain structure. Anything that symbolically takes you out of that mode means uncertainty. Something bad is going to happen. The next tooth is going to fall out. And the internet does nothing when it comes to self-diagnosing, anything but intensifying that anxiety, reassuring her, showing where things out, and listening very carefully to what else is going on that is that's compromising his sense of control. Teeth give you power. Speech, biting, it's so primitive. It's a very primitive structure as far as the unconscious is concerned. So I would say exploring other sources of anxiety regarding to loss of control. That's what I would suggest. That's an incredible question. I hope we can do a follow-up. I hope next time I'm here, I would like to hear from this doctor.
Okay, thank you, Micah. Next question. Is there any contraindication to sleep appliances in psychologically ill patients? You want me to repeat it?
I just need a little clarification on psychologically ill, because that highly anxious person, highly depressed patient, person with dissociative tendency. I'm not sure which one of those, because each one of those, um, you have to kind of take it different. By ill, do we mean highly depressed individual? Um,
Well,
depression, yeah.
perhaps we can get the member to clarify that, and I'll move on
Let's
to
come
other.
back to that, though. I
We'll come
would
back
love to
to it.
help.
Okay, so
Yeah.
could the member please clarify for Dr. Sadigh's benefit what psychologically ill means? Okay, another shorter one. What are the characteristics of a normal? What? This is clearly not me. What are the characteristics of a normal, healthy personality?
That's a beautiful question. I would stay from normal. I would say um, healthy personality is a personality that is adaptive, willing to adapt, is flexible. There's some level of flexibility in it, and there's a desire to grow. There's a desire for growth, which means I have all these credentials, but I like to learn something new that I don't know about. That's a sign of uh, that adds to the personality dynamic. Flexibility is one of the determinants of who suffers under change. Um, Maybe down the road, maybe at one point I will should give a lecture about um, hardy personality. People that under severe, horrific conditions actually do quite well. Um, and I'm going to make a couple of suggestions from Cobase's study. They have a sense of meaning. They're guided by their meaning versus by the environment. Um, and let me throw in something really good. They have a sense of humor. They're good at they laugh at themselves. I don't mean they demean themselves. They laugh at themselves. They use good humor, not the biting humor, putting people down. Um, and they have good social support. So a person who has I don't know what normal means actually. It's the middle of the normal sounds almost boring at times, but healthy, I know what it means. It means dynamic, alive, learning, and adaptive, uh, willing to make adjustments, do things a little differently. And I know all of you have done this with COVID, how you've changed your schedule, your office practices, etc. You've done a beautiful job. I have no doubt about it. So that's adaptive. No, I'm going to close my practice until COVID goes away. That's inflexible. I don't think any of you has done that. Thank you for that's a beautiful question. I should have started the talk by talking about healthy personality. It's adaptive. It's flexible. It's wants to grow. You want to learn. And
Oh, okay. By the miracle of the internet, I have a amendment or an update to the question, which I'll read. Is there any contraindication to sleep appliances in psychologically ill patients? And the questioner has modified that to say to include the three groups you talked about tonight.
um,
Does
yes,
that make sense?
yes. No. Thank you so much. Then, and what you're talking about. Thank you for clarifying. You're talking about anxiety. Yes, yes. There is indication. I remember seeing one that a wonderful doctor was working with, and he was just turning to be disastrous. Is that anxiety? Anxiety is the fear of the unknown. And this patient, where I was asked to do a consult, it was just one session. Was the doctor has given you? I'm going to swallow this thing. So fear of the unknown. You have to remove you see. So when there's anxiety, you want to remove any potentiality for the mind to go in a direction that it's what ifs. You want to address those what ifs. This is clinging to your teeth. This is fastened over here, etc. So just anticipating those types of questions. Yes, highly anxious person will potentially respond negatively. In the middle of the night, I took it out because I couldn't breathe. Or so instead of wearing in the middle of the night, why don't you wear it an hour or so here and there, kind of get used to it until your body makes adjustments. So make the unknown known. Thank you so much. So You're referring to anxiety. Yes, absolutely. You're putting something in their mouth, and there are all these questions: what can it do to me? And am I going to swallow it? Is it going to press again? Something in my mouth, etc. Yes.
Good. Thank you. Next question. I have a 55-year-old woman who presented recently as a new patient. She was given an anterior bite guard, in other words, a different kind of night guard, 8 years ago by a dentist who, quote, finally understood her problems. The night guard was absolutely disgusting. She also has never gone to sleep without it. She's developed some gum sensitivity, and I innocently suggested that she leave the night guard out for a week to let the gums heal. The look of panic on her face shocked me. How do I help this woman? What would have been a better way to recommend not wearing the appliance? Thank you.
Wonderful. So it's structured that at some level was containing her anxiety. You're being a wonderful doctor that you are, caring about the suggesting sort of helping the gum to heal. That actually suggests that you're removing a structure that I'm used to for all these years. It has helped me at some level, and removing this means I'm going to regress. And the answer, support will be, and doctor, this is from your practice, your discipline, that you need to say this, that not wearing this for a few nights will have no effect. You will not have a setback. You will not go back to years ago. None of that. Just a couple of nights. It will not do nothing to your breathing. It will do nothing harmful to your teeth. Not wearing this, etc. This is simply going to help the gum to heal. Actually, you will sleep better. So just a few nights for this to heal. You will not go back to reassuring, repeating yourself a bunch of times will help. And then one suggestion I have, and again, it's totally up to you. You may say that instead of wearing this, let's have one of those. Remember, they're almost like a button that you put on your front teeth that just fastens to it. Something of that. So instead of this, you can wear this, just to create space, etc. But let's heal them. When you see that expression of panic in their faces, one fear is that I'm going to go back and to something that happened in the past. So by reassuring them that no, your gum is going to be healthier, we can avoid some other complication, etc. It's really about reassuring, and sometimes kind of mirroring. When I said that, I noticed that you got a little bit upset. This won't do any harm, giving your gum a chance to heal. So be reassuring, but mirroring. Meaning you're not alone. I sensed it. I'm with you. Don't be afraid. Acknowledging that expression is actually by itself very healing. That I'm not dealing with a mechanical being. That I noticed you got anxious. Let's talk about it. That's a great question. That's a good. That should be in a textbook, actually.
Okay, thank you. Well, we have a great audience. When you come to visit Canada, we're going to keep you on your toes. Speaking of which, I have to be on my toes. I'm scrolling through a 9-score-H box on my computer. I think I've already asked this because I'm going up and down the list. Have we talked about the normal, healthy personality? I think we did.
Yes.
Okay, ready for a nice long one. Patience. Usually men will often say that their sleep doctor told them they don't have, quote, much of a problem and that they don't need to do anything. However, their snoring is really bothering their spouse, so they've come to me as a dentist to discuss oral appliance therapy. When I see their sleep studies, they've been diagnosed with moderate to severe sleep apnea, usually REM related. These patients, I believe, have heard what they wanted to hear. What would be the best way to speak to these patients to inform them that their understanding of what the the physician told them is incorrect. In other words, how do we undo what the good doctor told them? And how hard is it to speak to men who only want to hear one answer?
Yes.
I don't know any patients like that in London, but apparently they exist somewhere in Canada.
That's great. So I need a little more information about this gentleman in terms of her personality dynamics to actually help you through.
I think it's a general question, Micah.
No. I understand.
Usually men.
This is so. Whenever you hear a patient say, "Well, my other doctor said this," it's like mom said this, and your dad, and you're telling me something different. So the first thing you want to do is extremely important that you do this. You do not want to split that's a bad doctor, I'm a good doctor, because you quickly become the bad doctor, and that's a good doctor. So the thing to do is, and it's very important that your tone is as soft as possible. And just imagine, you don't want to go up or down. Just maintain that. Speak with them again in a tone that is that is supportive and educational. You don't want to raise your voice, nor they say, or lower it. You just maintain a level of volume. And this is what you need to say: is that, Dr. So and so has a point of view. I understand that he's looking at this data, etc. And I'm looking at this data over here, and I understand what he's saying. And then you gradually introduce a systematic versus just a quick answer. There's no problem with your sleep, but you say, but when you look at this, here we are looking at this data. So you want to create a case. You want to explain your case systematically with a sustained tone, and ask them every once in a while, does this make sense to you? And repeating that is extremely important. Does that make sense to you? So not rejecting them, but confronting them with data properly. There is snoring, and we see some disturbance in REM. REM is very important. It does the following things. It's a part of sleep, etc., etc. Look at this data over here. So in a way, you're saying the quick conclusion of Dr. X may be inaccurate because here we have good data and it shows us, and this is one way of improving it. And I think we should give it a chance. And then by ending that conversation by saying, what do you think? To give them power so that they're engaging in that conversation. Well, yeah, but then they may repeat, but Dr. So-and-so said this. Don't get upset because they're repeating that. So, yeah, I understand that, but let's go and repeat the data. What did you find out about this data? So you don't want to ever put another doctor down, even if they're wrong, because you're going to get into a fight between two doctors, whereas you're the doctor with data supporting your actions. And it's not an opinion. I will actually use that term. This is not an opinion. I just want you to see I'm going by the data that's produced here, and I am concerned about this. Your steadiness in your voice suggests that you have confidence in what you're saying. Data supports you. You're looking for a confidence. I remember a patient once said to me, Dr. So-and-so said that to me, and I said, just please have a seat. I'm going to go get one of my journals and kind of show you. So I went to grab a journal and said, that's enough. That's good. You know what you're talking about. You know what you're talking about. You're going to get a journal, show me some kind of article. You know what you're talking about. So.
Good. Thank you. Another short question, Mike. I think I did talk about this one. Thinking about your topic tonight, is there a certain age group that elicit more symptoms? Is there a certain age group that elicits more symptoms?
Yes, that's a fantastic question. Very, very important. As we grow older, we have more anxieties and fewer fears. So, um, in adults, you know, when you're younger, you have many fears. You know, what would this do to me? What is, etc. Fears is a known source of threat. They begin to diminish. You have fewer fears, but the unknowns in our lives will actually intensify. Um, we actually see this very, very clearly, and it literally, your system and our system says that we have not done a good job treating women with anxiety. Women tend to experience greater levels of anxiety um, when they approach midlife. And midlife, I don't know what midlife is today anymore, but it's changing, it's shifting. But because of the uncertainties that they have to deal with, women tend to have more inflammatory problems they reach midlife. So, am I going to be able to ambulate? What's going to happen to this and that, etc.? Am I losing my hearing, my eyesight, etc.? So anxiety levels go up. That is a fantastic question. Thank you for that. So yes, your patients in their 50s will have a different intensity of anxiety versus those in their 30s and 40s. So early life, anxiety is very high, fear is very high. And then gradually anxiety intensifies during adolescent years, intensifies, reaches new heights, and then gradually drops. And then the 40s kind of pretty much gets flat. And then in the 50s, 60s, tends to go up again.
So I have something to look forward to.
Well, anxiety is a fear of the unknown. So if you make the unknown known, um, and you're driven by meaning versus environmental events, then you can protect yourself. That's why, to me, meaning plays such an important role. Just to add, structure reduces anxiety. Please write that down somewhere. Structure reduces anxiety. You want to reduce anxiety? Um, make things very clear to your patient. We are going to do the following. Week one, we'll do this. During this hour, we are going to do the following. Anxiety comes down. Um, that's why um, cultures that have structure, you know, religious structure, national structures, etc., they actually experience less anxiety because structure contains anxiety. So add structure to your sessions when you're dealing with highly anxious people. Um, so don't talk in abstraction. Put a piece of paper in front of them and draw a hypnogram and show them. We're going to work on this part. You're going to wear this for these many hours. Okay? And we said to reduce anxiety, make the unconscious, so make the unknown known, and create structure and add structure. Structure reduces anxiety until it suffocates us. So too much structure isn't good either.
Okay, thank you, Mike. I'm hearing a bit of an echo. Have you changed your microphone or speakers at all?
No, okay. No.
All right. Okay, so you've done an excellent job, but now you're on the hot seat because this question comes from a doctor who has a patient tomorrow and she needs your help. So
I'm here to serve. I'm here to serve.
I know you'll do fine. So this is the statement. My friend has come to me for oral appliance therapy. She is someone who suffers from extreme low self-esteem. I recommended a few simple lifestyle changes that she could start working on to help her with her anxiety, insomnia, and sleep issues. Breaking her addiction with her phone was one of them. Here's the point. I'll be seeing her tomorrow. How do I ask her if she's been able to make any changes to her habits without making her feel like I'm judging or blaming her?
Yes.
She's going to be a long work in progress, and I want to help her now as her dentist and obviously friend, and don't want to offend or scare her away. Thank you.
Oh, thank you so much. That's a fabulous question. Now, please just hypothetically, if this is someone with a avoidant personality disorder in which we see low self-esteem and self-critical tendencies, if that's the case, then saying, did you do the following? Now, did you get those things done? Will be injurious to this person. And it is very likely that the person says, you injured me and you're going to hurt me again. I'm so dumb, I won't come back. So I will, I will not bring up this exact specific um, um, suggestion that you made. And I would start with something so general like, how are you doing? So tell me what's working and what is not working. Um, and one way of reducing a person's anxiety when it comes to, well, you told me to do this, but I'm not haven't quite stopped doing it. I actually would say I have this similar problem. When I try to change something, that is really hard. I struggled so hard to give up chocolate. It was so hard. You wouldn't believe. Humanize yourself. That you're not a god. That you struggle as well. That you make mistakes and you have had a hard time bringing about change. Um, but then I would say, if she gives you some clues, then you say, instead of doing 5 things, why don't you work on one, and then we'll check next week. And you tell me, okay? You tell me. I won't ask you. You tell me if this is working. You're empowering, and write on it on your card or something like that. Why don't we do this? And you tell me. I'm just waiting for you to tell me. I want to see how strong. You're probably stronger than me, um, but because I struggle, and I won't make this up. I won't lie to her. I would focus on something that I struggled with, something that I had to work hard at. Etc. We can work together. We'll figure this out together. Self-esteem ultimately means I don't like myself. And the best way to heal a poor self-esteem is to, doctor, please listen to this. You want to mirror their positive qualities, their positive capabilities. I love your perseverance. I'm not that person. You're here and you're talking. No, I love your perseverance. It always has to be genuine, so you have to be a genuine mirror. But mirror the strength, their capabilities, things that they've accomplished, etc. So that mirroring will build, oh, there's something good about me. You're mirroring it. They can't see it. So poor self-esteem, which often people confuse it with self-image or self-confidence, means how much do I like myself? So if you keep showing me that there are good things about me, it could be as, oh, I love your scarf, the way you're wearing that scarf. Has nothing to do with teeth, but it's, oh, the doctor likes the way I'm dressing up. Some simple thing about their attire, their external feature. So once they walk in, just scan them, find something that genuinely you can admire or give positive feedback. And I want to hear from all of you, by the way, all these great questions. Now, if you were in my classes, I would have given all of you extra points.
I think I see a hand or maybe.
So I've got this 28-year-old who was in a very bad car accident 5 years ago, and she's fused from C3 to the occiput, cross, and down. So she can't move, but she's doing amazingly well. She's part-time at university, but she's always tired. She's in pain, but she doesn't look like she's in pain, but she is, and she's tired. She can't focus for long periods of time. She takes THC daily. That's the only thing she's taking for pain, which seemed on the small side. Anyway, so she lives with her parents. She's intelligent, and she's not a regular patient of mine. She found me off the internet. So I gave her an aqualizer after doing a long intake form. Sounded like a lot of the other TMJ sleep patients I've treated. So I gave her an aqualizer, and like a day or two later, I'm talking to her on the phone, and she sounds like a totally different person. And she wore it for 10 days, 24/7, and remarkable difference. Lots and lots of good things happening. So she signed all the forms, and then a couple of weeks later, she tells me she's talked to some other doctors, although she doesn't say who, and they told me the laser would be a bad idea, and they told me it'd be not a safe thing to go to a sleep lab. So, so I said, well, it's kind of interesting that you would take the word of people who don't know anything about the treatment and didn't think it was important to even ask me before they gave you an opinion.
Yeah.
I said, opinions are nice, but I've had this happen before, and they usually call me.
Yeah.
So she always goes back into I'm very anxious. You know, if I say vitamin D helps with sleep, and you should probably consider taking that. Oh, it's making me anxious.
Yeah.
So when I told her, you know what, I don't think that I can treat you because you're changing. You want me to not do so many things that I can't predict how this treatment's even going to work, but you're going to want it to work. So we can't. I can't treat you. You know, and unless you write down everything that you would like the treatment to treat, and tell me how are you going to react if things aren't what you think you're expecting them to be, because I can't tell you what's going to happen. I just know from the tranquilizer good things will happen. And you know, so I'm looking at all this and I'm wondering, is she cooperating? Is she not cooperating? Then she said the laser will be fine. There's just something not right here.
Yes. This is a highly anxious individual, and it may be a good idea. You know, if you feel that she's splitting you, and she's going by what they're saying, you know, sometimes you have to say exactly what you say. I may not be the right person to treat you. But I'm suggesting you need to follow my suggestion, etc. And it's there's I hear clear dependency issues, a whole set of them from that brief description that you gave, and I like what you said, that to engage her in terms of what she needs, what are her needs, actually writing those down. Now, I would I you know it's a natural thing to respond in this fashion, but I would avoid any tendency to criticize others. I love what you said about, you know, people have opinions about different. I really like that, but kind of restating what you can do. I can do the following things, and see when we tend, and it's so natural to do, and I'm sure every one of us does it. When we become defensive, that also suggests that that we are somehow vulnerable, and that we're not as confident about our capabilities. So defensiveness often suggests that we are struggling with some kind of an anxiety. That's why when I was talking about maintaining your tone of voice means I'm confident about what I'm doing. I may consider other points of views, but when it comes to my treatment strategy, I'm confident about this. And you know, Paul, I will actually use those words, and I will say, I'm confident about this approach. I'm confident about these types of interventions. I'm confident about it. I'm not going to just simply suggest something. Could vitamin D make you anxious? You know, I've never seen a single study suggesting that. I haven't. I really haven't.
But she didn't mean the taking of it. She meant, here's another thing that I got to remember.
Yeah. And I would say, if I'm suggesting something, because I've studied it, I've looked into it, I have confidence. You know, it will be a nice addition. It's not just one more thing. It's something meaningful you're adding to the regimen, to our intervention. And I will say, her name, Matilda, I won't just suggest things for the sake of suggesting it. We are a team here, and I really want to help you out. And I'm confident what I'm suggesting here will help you out. And you saw some improvements and more improvements to come. So kind of gradually give her a sense of hope, empowerment, but also the fact that just for a moment, if you don't mind, and I know you have children, it's like going home and saying, there's a storm out there, and mom says, "Oh my God, I wonder what's going to happen to the house." The child anxiety will shoot up. Like, honey, there've been storms before. We can handle a storm. It's okay. And if that happens, so what? We'll fix it. It's the mom and dad being able to even contain their own anxiety to reassure is what that person takes with them. So,
Well done, Micah. And on that point, I think in respect of the almost 2 hours we've been together tonight, I might invite your newfound friend, Dr. Alter, to reach out to you privately to continue this conversation, as I'm sure it will.
Yeah. Please email me. Anyone, you can email me. And if you don't mind, I'm sorry to interrupt you, Dr. David. So if you don't mind, I will, since I'll be back in 2 weeks, I will give you my slides, which will include both.
Right.
Both parts 1 and 2. So you'll have one set instead of two. So just hang in there. I'd like to reassure you, you will have all the slides, every one of them.
We're very anxious up here in Canada, so we need to be reassured.
You need to take a Xanax between now and then.
Can you bring
Yes. All right. So on that happy note, I will call to an end webinar number 7 for the 10th of February. We will see you all here in 2 weeks on the 24th for return engagement of our speaker, Dr. Micah Sadigh from Cedar Crest College in Allentown, Pennsylvania, I believe. It's in